Good.
All right. So, wonderful. Let me look and see. Um, you, if you don't mind, I'm going to check to see what you have now. But before we get going, for compliance, I just need to get consent from you to kind of go through the plans. Is that okay with you?
Okay.
Okay. So this just allows me permission to kind of go through it, explain the programs to you. Whatever we discuss, you've signed off on is all it is. Let me just make sure I've got your information. And what do you currently have now? Do you know?
Humana.
Okay, wonderful. And I'll look you up. And if you are okay with that, I can just kind of see your history. How's things been going?
Good. How are you?
Good,
today?
very good. Kind of hoping the weather's going to clear up a little bit.
Yes.
Boy, it'd be nice to get some warmer weather. All righty, make sure I got your. And are you having any challenges with your current plan?
Those co-pays are too high.
Okay, let's see if we can get you a lower copay.
Charging me $40 to see my specialist.
Oh wow. Okay, yeah, I think we can do so. Hi, how we doing?
Hi.
I was wondering if I could take that.
Go ahead, yeah,
Yeah.
please. Make sure I got the walk in. Okay, so all you're gonna do is, and you don't have to. All you got to do is just make contact with the screen and lightly just sign your name,
Okay.
which I'm gonna do. I'm gonna clear it. But if it was not a clear, then I would go down, save it, and then I can put it into a PDF format. All right, let me pull you up here. Real quick, if you don't mind. I'm just wanting to see your current plan so I can see if we can help you get you a little nicer situation. And while I'm doing that, I'm gonna kind of go over a few things with you. But first, if I could get your phone number, and if you don't mind, I'm just gonna go ahead and add me to your phone, okay?
Okay.
Because you get a lot of soliciting calls, and I'm local. It's a lot easier to deal with a local person, face to face. That's the way I look at it. Otherwise, you're getting someone calling you from New York, Florida, and they'll rarely call you back. And sometimes they'll put you in the right plan, sometimes they won't. All right. Let me just make sure I have all your information here. Very cool. Hang on just a second. Alrighty. Yeah, and do you have a particular pharmacy that you prefer to use?
Walmart.
Very good. Walmart's excellent. I really like the pharmacy staff here. They do a really good job. And I'm always going over there to see if they have any questions because insurance can kind of change and get tricky. And do you have a particular preference on hospitals or doctors here that you prefer?
No.
Okay, and then we also have programs for anyone who has a chronic illness for diabetes or heart. Would you like to hear about those?
Yeah, I have diabetes.
Okay. And while I'm doing that, I'm looking you up here, and I'm going to go through a couple of things with you. Do you know if you receive any kind of financial assistance to help pay for your Medicare or your prescriptions at all? Any kind of Medicaid?
No.
Okay. Do you have any kind of tribal benefits or veterans benefits?
No.
Okay, very good. No other insurance through like a spouse's employer, TRICARE?
sir.
Okay, very good. And I got your A and B dates there. Very good. All right. We go in here. Okay, so real quick, it looks like you have an Advantage plan. Let me just be sure we're on the same page. I'm going to go into a program that I think will help you. It's brand new, by the way. And I did add myself to your phone. My last name's pronounced McMenemy. And I appreciate if you need anything, just let me know. I'm kind of your one-stop shop for everything. First off, you've got Medicare A and B. This is your red, white, and blue card. Okay, you don't actually use it. What I'm going to show you, you won't use it either. So even if you have it, you're going to leave it in your wallet, tucked away in a safe place. Part A is your inpatient hospital side. That is premium free, doesn't cost you. Part B is your doctors. This is the one they take out of your check unless the state pays for it. It's $185 a month. And that will continue regardless of what plan we do today. Now, when you're on Medicare, you have these two different routes. Option one is where you add a secondary, a separate drug plan. But we're gonna go with option two like you have now, which is Part C. All it is where you're getting your Medicare benefits through a private company. So you're gonna be going through any one of the companies that I write for here, whatever's gonna be the most beneficial for you. It's not a Medicare supplement. So it covers your same A and B benefits, but you don't use this card. You use this plan for all scheduled care, okay? And they come in the form of HMO and PPO. That just means your HMOs, you have a network of providers that you want to stay within unless it's an emergency. PPO, you can go in or out of network, but you pay a higher cost share. But this one that I'm going to look at is for if you have a diagnosis for diabetes and heart. So we'll look at that first. If you volunteer any certain prescriptions that you take, I'm not really allowed to ask you what you take, but if you want me to just check to be sure they're covered, I'll be glad to if you want to let me know. Alrighty, and I'll go ahead and stick that in. And you said you use Walmart. Okay, very good. And it's Mounjaro. I know that's a pretty pricey drug, but it works very well from what I understand. And lisinopril. Okay, so this chronic special needs plan that we're going to look at, it is an HMO. So that just means that you want to stay in network. One of the nice things about the company that I'm going to look at is they have all the hospital systems in network. So there's 4 main ones right here in Tulsa: St. Francis, St. John's, OSU, Hillcrest, and they have them all in their network system. So that they're one of the few that is in that situation. In fact, there's only 2 companies in Tulsa that are set up that way. Alrighty, and got your prescriptions there. Okay, so this is through a company called United Healthcare. Are you familiar with United Healthcare?
Yes.
Okay, and this is their chronic special needs plan. So all that means is ability to enroll in this just means that you're diagnosed is all with a chronic illness. Now what's nice is United has a one-card system for all their plans, meaning on one card you got your medical, hospital, dental, prescription, pharmacy, and it has a spending benefit where you flip the card over, there's a magnetic strip. It works just like a credit card. And with this plan, those that qualify to get on it, you not only get a credit on your card, we call it the U card, for all of these products that you can see here, food products from fruits, vegetables, dairy products, to over-the-counter pain relievers, cold remedies, the stuff over here on this side of the pharmacy, okay? You get to earn rewards and they add to your card, and then you can use it to check in at the gym. You have a free membership at fitness facilities in town. How does that sound?
Good.
Wonderful. Now this plan here is a 0 monthly cost. As I mentioned, you know, they still take out your Part B like we talked about over here. Now, currently there's no medical deductible, and you have no copay at your primary care. Specialists are $30, okay? You do not have to have a referral, and that includes, you know, foot doctors, eye doctors, heart doctors. Virtual visits are 0 copay. Preventive, your annuals are no copay. And then your hospital, you have all 4 of the hospital systems right here in Tulsa. You have a daily copay as all of $325 per day, days 1 to 6, and then you go to a 0 copay. Now, this plan has a max out of pocket. What that is, very simple, is that's a cap on your copays, okay? So every time you pay a copay, it goes against this number with the exception of your pharmacy. And should you reach that, United assumes all costs the rest of the year, okay? Skilled nursing, this is if you're in real bad shape and they move you from a hospital to an inpatient rehab or like a nursing home to recover. They usually average stay is about anywhere from 5 to 11 days is all, but there's no copay the first 20 days, okay? After day 20, you go to $203 copay per day, days 21 to 100. Outpatient surgery procedures, $325 copay. Mental health, this would be if you outpatient mental health, you have group $15, individual $25, virtual $0. Now, what I really like about United is your testing. Some of the other companies can charge $300+ for an MRI. Those are rare tests. Not too many people get a lot of those in their life. They are a lot more expensive than an X-ray or lab. With this plan, you just have a $225 copay, okay? And that includes CT scans. Now, when you get into just your X-rays, those are $15 on this plan. Not bad at all, okay? $0 for lab. Other diagnostic, just $35. If you take an ambulance, it's a $180 copay, and that includes ground or air. So even if they airlift you, and I've heard airlift could be several $1,000s. ER is a $125 copay, and urgent care, which would be like a minor emergency, $50 copay, okay? This plan gives you a routine physical at no copay. So that's something that Medicare doesn't cover. A lot of people just get a wellness exam, a routine eye exam, also Medicare doesn't cover. That would be like if you're just reading the chart and they write you a prescription, $0 copay once a year. And then eyewear, every 2 years, this plan pays up to $250. And that's either frames or contacts, one or the other, okay? And it resets every 2 years. Now, dental, you have preventive dental, that's your cleanings, x-rays. There is an add-on you can do later for more major services. If that's something you need, we have other plans that cover that. But a lot of times people start with the preventive, go in, find out what's going on, and then you can decide if you need more at that point. Hearing, United's very competitive on hearing. I will tell you, they have multiple carriers and multiple devices. You go in and you've got lots of different brands to choose from. 7,000 providers. They have a very good website, uhchearing.com. uhchearing.com, and you can get over-the-counter hearing aids like you get it like Walmart or Costco for just $99 on up to $829 through their website, or scripted ones that require prescriptions where you have a lot more adjustments and channels from $199 to $1249. Again, you go through the website to order them, and the network of providers to go to is on the website. The hearing test costs you $0 at any of those providers, and they fit you with multiple different brands on those scripted ones. They have a very good fitness program called Renew Active, and there's no copay for that. You can just use your U card, your 10 Gyms, Planet Fitness, Besa Health Club over here, and you can use any of those that are in the network on that. Routine foot doctors, $30 visit, copay per visit. You get up to 6 visits a year. And then your spending card. Now this is really nice. Like I said, your card is all in one. It's got a magnetic strip on the back, and they load $82 a month on that card, okay? You can use it on over-the-counter. As I mentioned, you can use it on healthy groceries. Your typical retailers, Walmart family, like Neighborhood Market here, Walmart, Walgreens, some of your Dollar Generals. You get rewards through United from time to time based on also different scenarios. If they do assessments or come and do an in-home assessment, they'll give you rewarded points, and they add that to your card. And that's a use it or lose it, just so you know, so it doesn't roll over. So you want to use it each month. If you go on a hospital or skilled nursing and you notify United, they will send you up to 28 frozen meals. So when you come home, you don't have to cook for a while. I always think that's pretty good. And then your drug plan. Now, the drug plan has, I'm gonna flip over here where it's a little easier to see, 5 tiers or categories, okay? 3 stages. There's a deductible stage initially, which would be an amount you would pay before the plan kicks in, but that only applies to level 3 or level 4 or level 5 drugs, and it's $340, okay, and that's annual. Then you go to just the copay. The level 1 and level 2, what's nice is there's zero copay at a preferred pharmacy, whether you come locally or go through the mail. And that's 30 days. And with United, they do up to 100 days. For some companies, just do 90 at zero copay on those. And that's a lot of your everyday medications, your generics. If you take a high tier, then you first meet the deductible, you pay the copay. And if you have an out-of-pocket with what you spend and others on behalf to a total of $2,000 for the year, you go to paying absolutely nothing, okay, the rest of the year. That's the catastrophic. All righty, any questions on that? Now, I want to just kind of, as I mentioned, give you the opportunity to look up your meds. You already gave me that, and I did that, and it looks like when I go in here, cost details, that the levothyroxine capsule is the only one that's not covered. We can relook at that just to be sure. Your Mounjaro is covered, lisinopril. Now, in your case, I'll tell you good news. You get extra help. And because you get extra help, this Mounjaro, which normally you'd have this $340 deductible and then have the flat copay here of $47, is only going to cost you $12.15 a month. No deductible. How does that sound?
Good.
You like that? And that extra help is based on your income, and it goes with you and goes into this plan from your present plan. Okay, so it's similar cost share what you pay on your present plan. Alrighty. Now, just to kind of go back through, as I mentioned, no matter how many times you go to your primary care doctor, it's zero copay. And if you have a primary care doctor you'd like to stay with, I'll be glad to add them to the plan as well. Do you have a particular primary care you want me to check on or provider that you see?
Sure.
Okay. Very good. And boom, boom. And if it doesn't pop up right there, then I usually go this route on Google and UHC, provider search, my doctor dentist, and yes, search. If it was a dentist, vision provider, I'd go there instead. Let's see here, medical, Medicare, and then just pick a zip code, continue, and then the plan, and we're doing the CSNP. That's one right there, so I'm going to select that network. Okay, and rather than choose here, let's see, and you said it was Dr. Chow. There he is, Christopher Chow. Boom. So if I have to do it manually, I do this number here. Because I need his provider ID when we get to that point. Okay. And then we covered this. A few more things. Chiropractors are $20 copay. You get diabetic testing supplies, brands like AccuCheck and One Touch at zero copay. Okay. They even cover the strips at zero copay. And therapeutic shoes or inserts on this plan at no copay. I think that's a pretty neat benefit. A lot of other plans that compete with this are 20% on therapeutic shoes. This is zero. Durable medical, 20% co-insurance. And you have home health at no copay, and hospice you pay nothing. Opioid treatment program, 0 to 15 to 25. The over-the-counter, as I mentioned, we're going to load $82 a month on your card. It has a magnetic strip on the back, so you just use that for your spending. And you've got thousands of OTC products, first aid pain relievers. Also, you could use it for groceries, healthy foods, fruits, vegetables, seafood, dairy products, water. Dialysis Part B drugs, you pay 20%. Any questions? Going back here.
Sounds good.
And I'm just gonna select a doctor to get past this screen. That's not gonna be the doctor that they go with, but it's quicker. Enroll. So, sound good?
It sounds good. Yeah,
Okay.
let's do it.
Is it okay if I go and get you set up?
Yeah.
There we go. And then here, I'm going down enrollment row. Boom, boom. That's why mouse is good. So you got any big plans for the weekend?
Now I'm just gonna see if it snows again.
Yeah, I don't think we're gonna get snow. You know how they say in Oklahoma with the weather, just stick around and it'll change.
Yes. Mhm.
Yeah. Yeah, and you know, Humana's a good company too. I write for them. But you will have more health systems here locally to choose from dealing with United, so that kind of makes it nice.
Good.
And I know a lot of people like to be access to like St. John's as well as St. Francis and some of the others. And usually it pops up when you just type the address in and bam, you just click on it. On that. All these. We're moving quick here. And boom, boom. Now, next. And this one. Next one. Oops, 3, 6. I like to tab over on this page. So I just tab over. And always the OEP through the 31st. There. If it's SEP for CSNP, we're going to go with this one right here. CSN, newly diagnosed with severe disabling chronic condition. Okay, real quick questions. Now, your ability to enroll in this plan is to validate you have the diabetes or heart diagnosis, and there's a form I'm going to let you take with you that you're going to have to get back to me before April 1st, okay? Now, real quick, have you ever been told by a doctor that you have, or clinic, you have heart failure, congestive heart failure, yes or no?
Yes.
Okay. And problems with your lungs, swelling in your legs due to your heart,
No.
yes or no? Okay. Past 12 months, have you been educated to lose weight because of your heart?
No.
Okay. Yada yada. I'm just gonna check these. Boom boom. I've asked you, and then physician name. Here's the neat thing. I had already picked it from here. So guess what? I got the name, the phone number. So I just put it in. Oops. Got my caps lock on for some reason. And next. If I can just get my computer to work here. There we go. And we've discussed this plan. Perfect. And current patient on the drop down here, there. Next. And then now, usually on these questions, a couple of things you just need to kind of make sure you're aware of. First of all, you understand that by enrolling in this, it's going to automatically cancel the plan you're on. If you happen to move, whether it's down the street or to another state, it could affect the plan you're in. I just need you to contact me, okay? Also, you understand this plan, ability to be in it, like I said, is to get the form back to us by April 1st. They're also going to send you a form, but I'm going to give you one to take with you. you understand that you must use United for all scheduled care, not your Medicare, right?
Okay.
And then it's not a Medicare supplement, okay? Boom, boom, boom. And then you pay the cost share with the plan, co-pays, co-insurance that the plan leaves you to pay, which is all in your evidence of coverage. And then you understand you want to stay in network. United has a great network, but the United app is a free download. I recommend it. I can add it to your phone before you leave if you want. But you want to stay in network on all scheduled care, okay? Alrighty. And then I'm just going to do that. So, and then finally, we go into the health risk assessment. All right, you can go ahead and pause it.
Okay.